Hello, everybody. Welcome back to Medical Myths, the show about what not to do with your body. And today we have kind of a hot button topic because once again, fentanyl is trending on Twitter, or at least it was a couple weeks ago when I decided I needed to make a video on this particular subject. This has been very polarizing for the past few years. In fact, I think primarily starting around 2016, we started seeing these myths about fentanyl floating around, especially with regard to police departments and police officers being exposed to fentanyl on the job. And we're going to watch some videos today and talk about kind of where these myths came from, what is true about fentanyl, and then kind of what has been propagated as propaganda in this particular area. So it's just me today. I don't have a guest because I thought that I wanted to give it more attention, at least from the science side. So hopefully this is informative and beneficial to all of you. And even some of the comments on these videos are absolutely ridiculous. But let's just get into the nitty gritty of this issue. So the first video, we'll watch maybe one or two of these to start off, and then we'll go into evaluating kind of what they say. And of course, I'll stop partway through because copyright and all that. But here's the first video. This is a case from Ohio, May 2017. I won't talk too much debunking this yet. I'm going to let you all get a feel for kind of the issue that is going on, and then I'll give my input later on. So here we go. Hope you're ready.
First, an Ohio police officer is recovering tonight after he was nearly killed on the job.
Police say the East Liverpool officer accidentally overdosed on fentanyl after he touched that dangerous drug. NBC4's Tyler Carter is live in Columbus.
So this was a case in Columbus, Ohio, in 2017, and they start right off the bat talking about how this officer was nearly killed on the job, accidentally overdosing on fentanyl. So right off the bat, we have some inflammatory language being used. They're already setting the stage to prime you to dislike this substance and to automatically think that fentanyl is the cause here. So I'm gonna let them keep talking, but just note the way that they talk about this and kind of what they're expecting the audience to think when they watch this video.
Police headquarters with more on what happened and why Columbus police have changed the way they deal with the drugs in the field.
Mike and Colleen, when officers know they're going to be coming in contact with unknown substances, they must first put on these nitro gloves. Columbus police officers say coming in contact with drugs is something they do every day. It's a challenge, and it's making it more dangerous for them to do their jobs.
So I'm glad that they have gloves now. I think they've always had them, but now they're making gloves more available. But we'll talk about later about why gloves are sufficient in this case. But they're using this idea of wearing gloves, or you'll see some videos wearing hazmat suits to kind of hype up the dangerousness of these drugs. So notice that if you were a layperson and you didn't know, you might think, oh, they have to wear protection. This must be scary. So we'll keep talking about this rhetoric as we go.
Just out of instinct, he tried to brush it off, not thinking.
An East Liverpool officer accidentally overdosed on fentanyl after searching a vehicle with drugs inside. Investigators say the driver of the vehicle was covered in a white powdery substance. That substance got on the officer. An hour later at the police station, the officer noticed the white powder on his clothing. He brushed it off, and that's when he overdosed.
All right, so let me communicate this timeline a little bit. So they are claiming that this officer was on the job. He was in someone's house or someplace, and he got this white powder, unknown white powder, on his clothes and on his shoes. He gets back to the station, notices that he has this powder all over him, tries to brush it off, and then instantly overdoses. So we have this weird timeline. So he's supposedly been around this stuff for over an hour with it on his clothes, and then the second he brushes it off his shoes at the station, he overdoses. Think about that.
Fentanyl can be ingested through the airways and absorbed through the skin.
It's a little bit more dangerous, and the results are deadlier than what we used to face in the past.
And incidents like this is why Columbus police have reevaluated their protocol when coming in contact with drugs. Columbus police say they can't put a number on how many times a day officers come in contact with unknown substances, but the drug epidemic is a crisis not only killing many in the state, but puts officers in harm's way.
Officers have always had gloves at their disposal. Now we make sure that
So then they talk about the use of gloves and all that. I don't care too much about that point. But for the rest of this video, they talk about how they've changed the educational protocol for how they talk about drugs. And this is where the panic started. So in 2016, they started mandating this course for police officers in many of these counties to have to learn about fentanyl, which there's a healthy level of caution to be taken when you walk on scene where there are unknown substances. But the way that they've educated these people is extreme, and it is nothing short of propaganda. So I'm gonna show you the a clip that I found from an police agency in California, and this website is supposedly last updated June 16, 2021. So this is pretty recent that they went back and said, hey, this education is still relevant. So that's kind of the news reporting that we see with the fentanyl issue. And then we go to how they are educated on what to do when exposed to fentanyl, but also education on just what fentanyl is in general. So here we go. Yeah, and Pumpkin J makes a really great point that I was definitely going to touch on in a little bit. And I'll wait till we get to that point. But here we go. I'm going to share. This is called Did You Know? And it says fentanyl exposure risks. And I'm going to have to talk in the middle of it for copyright reasons, but I want to get through this as much as possible without interrupting so you all can get a feel of what we're dealing with here. We have this scene already. It's this very eerie scene, eerie music.
Overdose. Okay, I have a few things to check out in the car. Okay.
Apparently, they picked up this person who is having a drug overdose, and they're going to go search the car. And they find some pills in the car. Then he goes to analyze it, puts the pen that he used to touch it in his pocket. And then there's that line, a few particles of fentanyl may be fatal. There's statement claim number 1. Did you know the risk of inhaling fentanyl is real? We'll talk about this one as well. Then he takes the evidence, goes off. He has a little bit of powder on his pocket. Yeah, and the font used for fentanyl is definitely inflammatory. This whole video is inflammatory. So he goes, puts the evidence in the locker. Did you know improper handling puts others at risk? I mean, yes, improper handling, but we'll get into that too. So then he takes, for some reason, he goes home on his police bike in his full police uniform with his police radio and everything. He goes home, which I don't know how realistic that is. And then his kids come over. He's got the fentanyl powder in his pocket, and his kid comes over to hug him. And then it says, are you recognizing your risk? Know your risk, assess your risk, mitigate your risk. All right, so what do y'all think about that? This is Jay, absolutely. This is made to scare people. This is made to scare police officers into taking certain actions. And there is harm. I know a lot of people might think, what's the harm in making people more cautious? Well, here's the problem. You have people who are exposed to fentanyl. Usually they're taking it by an oral route. Some people might be injecting it. But you have people who are actually overdosing and who need help. And now you've terrified these police officers and EMS workers, saying that, oh, you're going to die if you come into contact with this. And this is not true. This is objectively not true. And so people might be more stigmatized and less likely to get help because the police officers are terrified to touch this. And even though police come into contact with drugs on a regular basis, they are not trained in pharmacology. They're not trained in medicine. So their knowledge on any of these substances are limited to what this propaganda tells them. So of course, if you're taught that this is dangerous and a couple particles are going to kill you, you're going to enter a scene differently and you're going to treat people differently based on this. So we can watch a couple more videos later on after we go over the kind of meat of what fentanyl is and what opioids are actually doing. And then I want you to look at these other videos and see what we think is actually going on there. So first of all, fentanyl is, of course, an opioid medication. And we're going to talk a little bit about how this works. And actually, I want to show you one more propaganda photo because this is another one that really goes along with what we just watched. So this is another image that I see showing up frequently. And actually pull up this. For some reason, it's not letting me show that one. There's a photo here. I can show you this one on the screen. Things like this show up quite frequently. So you have the multiple vials and you have the heroin with this slightly more amount of powder, and then the fentanyl with a very small amount of powder, showing supposedly, what it's really related to is the potency. And we're going to talk about potency. But this is using the potency as a measure to terrify people. And it's making an equivocation fallacy to say that because this fentanyl is that much more potent than heroin, that this much getting on your skin or this much being exposed is going to cause that much effect. And that is not true. It is not accurate information related to pharmacology, because not everything that you're exposed to is going to get into your system. And that's not how this works. So I want to show you another diagram. So when you take fentanyl, fentanyl is roughly 80 to 100 times more potent. And I'll show a graph related to that. But here is a diagram showing how fentanyl works when it gets in your system. So you have a full agonist on the one side. Do not really look at buprenorphine. We're not going to get into that right now. And I'll talk about what an agonist is to catch everybody up. But you have fentanyl that's going to bind to a receptor. And there are multiple types of receptors that are involved in opioid physiology. So you have mu receptors, which is what's being shown here. You have 3 types of mu receptors. And you also have delta receptors and kappa receptors. And kappa receptors are more responsible for dysphoria. So sometimes if you take an opioid and you don't like it, some people really do not respond well to opioids, and they might get dysphoric and upset. And that can be caused by an abundance of kappa receptors. So someone with more kappa receptors might have a less optimal, less pleasant response to fentanyl. But if you have more mu receptors, which is what fentanyl and morphine and these agonists are targeting, these are related to analgesia, so pain relief, euphoria, dependence, respiratory depression, meiosis, and decreased gastric and digestive tract mobility. So when you get opioid constipation or opioid urinary retention, things like that are related to mu receptors, along with that euphoria and the respiratory depression, which is the main cause of death in opioid overdose is respiratory depression. Delta receptors, not as much important. They do have a role in analgesia and also in the gastric motility. There's also nociceptin receptors, which also relate to analgesia, and zeta receptors are something else that is not really important at all. So we're going to focus mostly on the mu receptors today. So you have this fentanyl or morphine or what have you that's going to bind to a mu-OR or a mu-opioid receptor, which is a G protein coupled receptor. So fentanyl is going to bind to this receptor, and then GI is going to be activated. So there are a few types of G protein coupled receptors. Some are S, which are stimulation. I is for inhibition, and Q is kind of similar to S, but a little bit different in the way that it operates. So fentanyl is going to work by primarily inhibition of neurotransmitter release. So once you stimulate this I subunit is going to move. It's going to inhibit adenylate cyclase. You're going to get reduced neurotransmitter release. Primarily GABA is going to be inhibited, which is an inhibitory neurotransmitter, which makes it a little more complicated. But basically, you're inhibiting this signaling throughout this axon. And you also get further inhibition by this upregulation of these potassium channels. If you can see up at the top of the screen, these are GKIRs, where if you have influx of potassium into the axon, it's going to hyperpolarize. I cannot speak today. Hyperpolarize, and it's going to not allow the transmission to go through. And we're also going to paradoxically inhibit calcium channels, which is a little bit different and a little bit more complicated as well, because that's more of a stimulatory effect, but not super important here. So you have this inhibition of the axon, and then this is going to modulate the pain response, and you're going to decrease the neurotransmitter release, but you're also going to then cause in decreased inhibition within the brain, you also get increased dopamine release, which is where you get the euphoria from. So switching to kind of the next step up, this is the microscopic level of the mu receptors, but let's see, I have another image of how this looks on the brain level. So you have all of these happening, and when you have pain, you have a pain stimulus coming in from the nociceptors in the periphery. So you have some trauma, or you have some kind of injury that's going to cause pain. It's going to go through the dorsal root ganglion into the spinal cord, and then it's going to send an axon up to the thalamus, and then that's how you get the signaling to the brain, to the cortex, and to other brain regions that have this mu-opioid receptor, which is in similar areas, which is how we get this this pain relief. So you have this afferent signal going from the periphery up to the brain, telling the brain that we're in pain. And then you have this efferent pathway as well, going from the brain down to the spinal cord to either tell them, yes, I'm in pain, or no, I'm not in pain, and to adjust the signaling from the periphery. So what happens here? There are two ways that opioids can modulate this experience. So number one, it can impact the pain stimulus in general from the periphery. So from wherever the trauma is happening, you get that decrease of neurotransmitter at that site, which then decreases the propagation of the signal to the brain. So essentially at this point, it's stopping the pain from reaching the brain, stopping the brain from recognizing that the pain is there at all. And then the other thing that can happen here with fentanyl is that it can enhance descending pathways from the brain. So it can take these pathways going back down to the spinal cord and say, hey, we don't need to be in pain. We're not worried about this, and tell it to shut off. So we have these two different mechanisms of where pain relief is happening. And in this, when these signals from an opioid are going up to the brain and activating these mu receptors, you have mu receptors in areas in the pons and in the medulla that regulate breathing. And this is where an opioid overdose is going to happen. You have decreased respiratory drive because you are telling your brain, that you don't need to breathe anymore. And so your respiratory rate is going to slow down and you're not going to breathe. So keep that in mind. Keep that in mind. When we get to these other videos of overdose, you can take that into account. They should be breathing slower or not at all if it is going to be a fentanyl overdose. So here's kind of the mechanism of fentanyl and how it works on a physiological level. And I have a couple more diagrams. So we have different types of opioids, of course. And you have, I guess this one's not going to let me show it. But you have different types of responses to an opioid. And I can pull this one up. Reopen it. You get different types of responses. You can have an agonist, you can have antagonists, and you can have partial agonists. And this is so weird that it's not letting me. I'm going to screenshot it, and then we're going to share it. So fentanyl, yes, is about 80 to 100 times more potent than morphine. But the issue is dose and route absolutely mattered when we're talking about pharmaceuticals. And one of the main myths, this is a very important myth to talk about, is that when they're talking about fentanyl, they're often talking about illicit fentanyl and not talking about the pharmaceutically produced fentanyl. So here is a dose response curve for fentanyl. I'm going to share this. So here we have morphine and fentanyl. So you see this curve, and this relates to the percent of response that you get to a certain dose of the drug. So you see morphine over here requires about 10 milligrams to get a 50% response. Okay. So if we move this curve to the left, that would mean that it takes less amount of drug. So as farther to the right on the x-axis we go, that is more amount of drug needed to get to that response. So if we move this curve to the left, we see that now we have a 0.1 milligram amount to reach a 50% response. So this is how we got the number of 80 to 100 times more potent. So here's an interesting thing, though. When we're giving fentanyl, is we give this as a pharmaceutical for pain relief. And I implore anybody to think about what it'd be like to go through a surgery, a major surgery, and not have something like morphine or like fentanyl. Fentanyl is very, very useful, and especially when it's used appropriately. And when we're giving fentanyl, we have it in microgram doses. And so you can think about morphine and this, yes, well, it's 80 to 100 times more potent than morphine, but we're not giving it in the same quantities that we're giving morphine. We're giving it in microgram dosages. So something else that I want to talk about here with this is morphine milligram equivalence. So this is what we use to determine how much of a certain medication we're going to use to treat someone's pain based on how similar of an amount it is to morphine. It's basically doing a conversion. And there's a handy dandy little app here that I like to use called MD Calc. I'm going to show you a little demo of this. So we have this chart here for morphine milligram equivalence calculator. So I can type in the amount of fentanyl I'm giving to somebody and see how much morphine it's equivalent to and how safe it would be. And of course, there's a disclaimer here of there's no completely safe opioid dose, but there's, of course, always going to be risk, but a lot of times that risk is kind of worth the benefits that you're going to get from these medications. So let's pick fentanyl sublingual tablets. Okay. And so let's say we have a dose of, and this is a very, very high dose of 100 micrograms. Give it once. 100 micrograms of fentanyl one time per day. So this is just once, one-time dose. You get a 13 morphine milligram equivalence per day. And this is an acceptable therapeutic range for acute pain in opioid naive patients. So someone who has never had opioids, this is a safe dose for treating pain. Okay, so keep this in the back of your mind. We're going to use this calculator again later to address some of these other claims that are used. But we can already see that, yeah, and Sabrina, we're going to get into this when I go to this study. So, some myths that are talked about with these fentanyl overdoses is, number one, we saw in that video this instantaneous overdose from fentanyl. We had that even touching a particle is lethal. We have inhaling any amount of particles is lethal. So let's see how valid these are now that we kind of understand the mechanism of fentanyl. And as Pumpkin J mentioned already, if fentanyl was that lethal, if it was so lethal that even touching a particle would kill you, we would not be able to use fentanyl as a therapeutic. It would not be a worthwhile thing to do. So that's just one point. Let's get into this study. So there's a study. We're going to go through this pretty carefully because there's a lot of really good points in this. So this is a study from, and I can zoom in a little bit here, from the American College of Medical Toxicology and the American Academy of Clinical Toxicology. Kind of works together to study this exact issue within the police departments. So the question is that they were addressing is there a clinically significant risk to emergency responders? And right off the bat in their abstract, they're saying no. And we're going to get into why. So we do have fentanyl being an agonist of morphine. So it is going to cause this similar response that morphine would. It's going to take the place of a morphine receptor, and it is going to cause a similar reaction in the cell. So there's concern about the opioid epidemic and with people overdosing on street fentanyl, and police are worried that they are going to be at increased risk of exposure just by being around it. So they also mentioned carfentanil, which is more potent than fentanyl even, and this was developed for veterinary medicine, but it also causes less apnea. So that's kind of a reason why carfentanil can actually be beneficial, because you get less of that respiratory depression. But in this study, they address a few key points. So they address the inhalation exposure risk, and they address the transdermal exposure risk, and some other factors. So for inhalation risk, so the idea here is that if you walk into a house or someplace with fentanyl exposure, that if you find this unknown powder and it happens to be fentanyl and you brush it off your clothes, that you are going to get an overdose from this. So talking about inhalation exposure risk, and this study is saying that it's very, very low. But some people were concerned about this because of a specific incident in Moscow in 2002. And reading into this particular incident, this was an act of bioterrorism by some people. They used an aerosolized substance, which was found to be carfentanil and remifentanil, which are, as I just mentioned, carfentanil is even more potent than the standard fentanyl. And there's possibilities that they also had halothane to further aerosolize this carfentanil. But you had people that were exposed to these massive amounts of carfentanil and remifentanil in this theater, and they analyzed urine samples, blood samples, and I think clothing samples from 3 or more survivors of this attack, and they had found these drugs on them. But this is a very, very high dosage. This is a bioterrorism level dose of carfentanil that has intentionally been aerosolized. So this is different than just incidentally coming across a powder and brushing it off. They also studied industrial producers of fentanyl and looked at their average occupational exposure limits. So what they had shown here is that the highest airborne concentration encountered by workers in plants producing fentanyl would require 200 minutes of exposure to reach a dose of 100 micrograms of fentanyl. So looking back at the MME calculator that I had, where we calculated a one-time dose of 100 micrograms of fentanyl being not really high risk for overdose, being an appropriate level for therapeutic use. So even though 100 micrograms is a high dosage in terms of per hour, I think it's the highest dosage you can get in terms of a fentanyl patch. But that is per hour, and that is over multiple days of time. So not even just a one-time dose. So this is talking to reach an exposure of a one-time dose of 100 micrograms of fentanyl, you would have to be exposed to an aerosol for 200 minutes. And that is not what we're seeing in these cases, and especially when you have people who are outside their cars, where a lot of these fumes, if there were fumes, are going off into the atmosphere. They're not in a closed space with this high amount of fentanyl. So it's not likely that they're reaching these 200 minutes of constant exposure to reach that 100 microgram calculation. And this is due to the vapor pressure being very, very low. So the vapor pressure relates to when you have a substance, how much of it is actively being converted into a gaseous phase or being in a solution with the other compounds in the air to where it's at risk for you to breathe. So with this low vapor pressure, it is not likely that someone is going to have high exposure, and especially over those long periods of time. So this is not an area of concern. And Pumpkin J, yeah, you're saying that patches you have are 72-hour durations. Exactly. So not a risk. So this kind of shows that the video we watched earlier about brushing it off and having that instantaneous overdose is not realistic, and it didn't happen. The next hot button point here is the dermal exposure risk, and I think this is the one I more commonly see. That fentanyl is amenable to transdermal absorption because of its low molecular weight and lipophilicity. So here's the thing too, that we have these transdermal delivery systems, and they take, as it says here, 3 to 13 hours to produce a therapeutic serum fentanyl concentration, and it takes 35 hours to reach peak concentration. So in theory, to a layperson who might not understand this time frame that it takes to reach even a therapeutic range, if you were to hear that fentanyl is 100 times more potent than morphine and that you can use it as a patch, that's enough to terrify a lot of people because they don't have the understanding of how these drugs work. The fact is, it took billions of dollars and a lot of study and engineering to produce these delivery systems. A patch was not easy to create. It had to have the right dosage, the right formulation of the medication, and has to have some kind of solvent to help it enter the skin more easily. And then they have to have it release continually and not just have a threshold reach right away. So there's some barriers to this being an effective mode of administration. So you can't just take a pill of fentanyl, because these are totally different formulations. The formulation of fentanyl used for oral administration is very different than what is used transdermally. So if you took even street fentanyl, is more likely to be an oral formulation. So you take that powder and you put it on your skin. It's not going to readily absorb because you don't have the ability to overcome the skin defensive barrier. You have to find some way to do that. And so these patch formulations have the necessary solvent to cause that to happen. So what they did here is they took some calculations of the fentanyl patches. And if you had, so we're assuming here that someone's body surface area is 17,000 square centimeters with a palmar surface area of 0.5%. And they are assuming here also that the fentanyl absorption is 2.5 micrograms per centimeter squared per hour. So that's a standard fentanyl patch. If you put these patches all over both palms, so you just cover this person's hands, you cover 0.5% of their body surface area in fentanyl patches that are meant to be absorbed by skin. So this isn't even the street fentanyl that's not meant for transdermal absorption. This is the proper formulation to enter the skin. You're covering their hands with this. You are giving this the best chance, the absolute best chance for it to cause an overdose transdermally. And it would take 14 minutes to receive that one-time dose of 100 micrograms. So once again, going back to our calculations here, and I'm going to show the example of the actual fentanyl patch because that's calculated differently. So once again, we go back here. So we had the tablet. So and even then, so we're taking the fentanyl patch, right? We have fentanyl patch, and the way this is calculating this is by dosage per micrograms per hour. And this assumes one patch every 3 days. So this is, if you were to get 100 micrograms every single hour, this is every single hour of fentanyl. It is a high dose of fentanyl for pain relief. You have 240 milligram morphine milligram equivalence, which does cause some risk of overdose. And you definitely, if you're going to be using this level of fentanyl therapy, you should not be doing this in a primary care setting. This should be done by a pain specialist, and you're probably hospitalized at this point. More than likely, you are hospitalized. So we're talking cancer patients. We're talking people with extreme amounts of trauma, people who need this level of pain control, and possibly in people who have tolerance to opioids. But this is even higher because this is per hour. Our example that we were talking about earlier was just a one-time dose of 100 micrograms. And then taking that as once again, as the oral tablets, we have the 100 micrograms per dose at 1 dose per day. Acceptable therapeutic range for opioid naive patients. So this is really not a concern. This transdermal overdose is not really something that we're worried about. We gave it the best chance that it could to cause an overdose, and it wouldn't. It's something else that they wanted to mention here is that this represents a steady state delivery after the drug has penetrated the dermis. So this whole scenario of the 14 minutes to reach the 100 micrograms, this represents the delivery at steady state. So assuming that this has enough concentration to continually be releasing after the drug has penetrated the dermis. So you would need more than that to actually get through to this point. So this overestimates the amount of absorption in the first few minutes. So when they're saying this initial period, as they're mentioning here, this is referring to, again, back in those videos where you have these cops that are brushing off the fentanyl. They brush it off their shirt. They brush it off their shoes. That's the initial period. That would have to last a very long time to cause any effect. So they're saying, based on our current understanding of the absorption of fentanyl and its analogs, it's very unlikely that small unintentional skin exposures to tablets or powder would cause significant opioid toxicity. And if toxicity were to occur, it would not develop rapidly, allowing time for removal. So there you go. Lease on Life has a question. So what is the drug I've seen people talk about that is put on dollar bills? Seems to be pretty potent because they say they feel weak pretty quickly. That's actually, they're talking about fentanyl. This is that myth. And I'm going to talk about what is probably actually happening here with these exposures. So something important as well. We looked at one of the cases in, I think the news video we watched at the beginning talked about the case in Liverpool and the case in Columbus, both in Ohio. And one of them, that the police officer supposedly had an overdose, was actually found. Take a wild guess at what the compound was in that case, because it was not found to be fentanyl. They were convinced. The police were absolutely convinced that it was a fentanyl OD. They ran and they grabbed the Narcan. They Narcaned this guy, said it took, I think a lot of these people are saying it took 4 doses of Narcan to wake them, which if something is taking more than 2 doses of Narcan, it's kind of safe to assume either one of two things. One of two things could be happening. If it was a legit opioid overdose and it did not respond to 4 doses of Narcan, either you have an intranasal pathology, so you have an obstruction, which many people do, or it's not responsive to Narcan and is not related to that mechanism of action. And Sabrina is absolutely right. In the Liverpool case, the Liverpool, Ohio case, it was found to be methamphetamine. So not fentanyl at all. And a lot of the symptoms, and I'm not saying necessarily that they overdosed on meth from this, and I don't think the person was knocked out, but they got very, the meth didn't knock them out. I'll talk about what I think happened. But they get tachycardia, they get tachypnea, so their heart rate's going really fast, their breathing's going really fast. And when your breathing goes really fast, you could be knocked out from hypocapnia or hypocarbia, however you want to say it. Both terms are correct. Hypocarbia and hypocapnia can both cause you to pass out. And I'm not necessarily saying it was the meth necessarily, but it was not fentanyl that was responsible. But they had assumed it was. And so they labeled it as an opioid overdose, but there was no fentanyl actually involved there. So interesting little thing. So I want you to think about kind of all of that. Why are these news reports inconsistent with the data? Why do we have this data from the Journal of Medical Toxicology and also have these cops that are supposedly overdosing from contact? How do we have this discrepancy? And I don't think there's much else I wanted to touch on from this. Oh yeah, I did want to talk about the protection. So this isn't to say that there is no risk to coming into contact with fentanyl or other drugs. Many times cops are exposed to a variety of compounds at any given time. And it is recommended that before going into a place with unknown drugs, that you put on gloves. And these nitrile gloves that they've been given are effective. As we saw with the low likelihood of absorption of fentanyl, the nitrile barrier is appropriate. That is enough. That is going to be enough to protect you in the field. And if you're really concerned about inhalation exposure, which again, very low risk, but let's say somebody was to conduct bioterrorism, if you give them an N95 respirator, that is shown to be effective enough to prevent toxicity in those settings. So what should happen then is cops should put on gloves before touching things they don't know what they are. And if they're really concerned about aerosols, they could also wear a respirator. And then really there's virtually no risk there. Cops popping hot on the drug test from overdosing after self-medicating. I don't know about that statistic, but that would be really interesting. What's the reason for this lying? I think there's a lot of contributing factors. I think fear is a lot of it. People are scared about what they don't understand. And cops don't know things about drugs. They really don't. They know what they're taught, but they are not medical experts, and they're not pharmacologists. They're not pharmacists. They don't have expertise on this. So I think the origin for trying to get people to be afraid, I do think that is related to a DARE program, trying to get people to not use fentanyl in terms of like injections. Like, don't be injecting it because it is potent. Don't be consuming fentanyl pills when it's not prescribed to you. Don't be using it inappropriately. But this is not a productive way to teach those lessons, because we're seeing these extra, more problematic outcomes from this type of teaching. So I want to touch on, I want to watch some more videos, and I want you to see if you can guess what's going on here. And one of these videos is silent because I think I don't know if they had a copyright claim and they had to mute it. But it's not important because I'll just keep talking through it anyway. I have a whole playlist of these, which is super fun. This one's pretty short, and so this video is called Watch. Officer collapses while packing up drug evidence laced with fentanyl. So we already have a clickbait title, but let's watch this.
The power of even the smallest touch of fentanyl shown in this video. Watch as a Bartlesville police officer wearing protective gloves is packing up drug evidence believed to be laced with fentanyl when he
starts to look like he's not feeling so well.
Becoming ill, lightheaded, and actually basically passed out or fell.
Seconds later,
and then he looks like he collapses on the floor.
I don't know what would have happened had they not acted.
And then they're going to talk for a little bit.
Sergeant Jim
and of course, they're going to talk about more fentanyl propaganda. They say they went and grabbed the Narcan, gave it to him, and it took somewhere between 2 and 4 doses of Narcan to wake him up. What do you think happened? Let's do some differential diagnosis here. What do you think, after knowing what we know about fentanyl, knowing the time frame that it would take to inhale fentanyl and get even a therapeutic dose? So he was there for not even a minute. What could cause somebody to pass out? Give me whatever you think. Anything that could cause somebody to pass out like that. Some possibilities while we're waiting for answers to come in. It's possible that he locked his knees. He was standing for a long period of time. It's possible he lost some blood flow and his knees buckled. Sabrina is on the track that I was going to get to. So I'll get to you people in a second. Blood sugar. Yeah, if you had low blood sugar, if this cop didn't eat very much during the day, felt nauseous and sick from low blood sugar, and you could have a syncopal episode from blood sugar. Vertigo, absolutely. Sleep deprivation is one. Yeah, if he didn't sleep, if he was working a night shift and was tired, that could cause him to be knocked out. And yeah, the one that I really wanted to touch on here, and no, skrunked buildup is not the one. Tons of mice. But a few people had mentioned it, and that is the panic attack. So let's think about this. Let's think about this entire scenario. And Exceptionally Average makes a really good point. Did he really pass out? We don't know. We saw video evidence that he collapsed. We don't know his state of consciousness. We don't know if he actually lost consciousness. There's a lot of variables here that we have no idea about. So let's think about this. You have a person, a cop, who has been taught since 2015 or 2016 that even small particles of fentanyl can kill you. Okay, so we have that propaganda video that we played earlier that says even a little bit will kill you, and on all that stuff, all the fentanyl in the weird fonts, and you're taught that. And then you go into the field and you see an unknown powder, and you have to take this back as evidence. So you do. And you might not be this cop, maybe a different cop brought that evidence back, and now this cop needs to investigate this evidence. So opens the packet and finds an unknown white powder. Okay. What do you think his reaction is? If you've been programmed from your training to be scared of this, and there are reports of journalists who have asked cops what their biggest concern was for going on scene of a fentanyl overdose. And it was not, their responses were not that they were concerned about the way people would act when they're on drugs. The primary concern and the primary source of fear for these police officers was that even a little bit of fentanyl can kill you. That was their primary concern. So going in with that mindset, you find this unknown substance in this envelope, and you open it, you see this powder. It's very possible that you'd have a panic attack. And what are some results of a panic attack? So let's compare things too. So we talked already about the mechanism of fentanyl. We talked about the opioid-induced respiratory depression, the suppression of the pons and the medulla, which control respiratory rhythm, which are then suppressed by these mu opioid receptors that are stimulated. So if we have that, we would expect people to be unconscious, but we're very peacefully unconscious with opioid overdose. Because your breathing just slows and it starts stopping. And, kind of probably the most disturbing thing that would happen with this is increased secretions. So you might have some gurgling or something, which is unpleasant to think about, but that's what you get with an opioid overdose. What you see, and we're getting people in the chat, for panic attacks, you get hyperventilation, syncope, dizziness, feeling faint. And that's often what we're seeing in these cop videos. So if you have an increased respiratory rate, which is totally the opposite of what we'd see with opioids, we'd see decreased respiratory rate there, and so we'd see completely different pathologies. So for opioid overdose, you have people who are not breathing. They are retaining carbon dioxide and not intaking oxygen. So what you're going to do is you're going to get acidotic with increased carbon dioxide. So carbon dioxide is an acid. You're going to get a respiratory acidosis in that case. With a panic attack or with any type of hyperventilation, you're going to get the opposite. So the carbon dioxide is going to leave too quickly, and you are going to get hypocarbia or hypocapnia, and that's going to cause a respiratory alkalosis, the opposite. You're becoming not acidic enough, too basic for this. We can make all the basic jokes that we want, but completely opposite pathophysiologies. So, yeah, and fear of death is also a symptom of panic attacks. Absolutely. So I want to show you another video, and I want you to tell me what you think is going on here. So this next one, we're watching body cam footage of a Jefferson County police officer. So we don't see the person, and it might be difficult to hear a little bit, but we'll try to talk through it while the video is playing. Yeah, they can't claim cops are having panic attacks. Yeah, it definitely. Police departments are not very good about addressing mental health concerns. Yeah, Pumpkin J, you can talk all you want in the chat about being being basic. So we have this video here. This is a Jefferson County Sheriff's deputy exposed to fentanyl. And so we have this deputy who gets in her car. This is a female. So she's sitting. So she's, I don't know if you can hear it very well, but she's panicking about there being fentanyl. She's like, there's fentanyl at that house. And she's calling for help right now. And she's still driving. So it's been a few minutes since she's actually had the exposure. And she's pulling over, requesting backup. And I'm going to skip ahead a little bit, kind of where they're going to pull her out of the car. Oh, here we listen to her breathe. I don't know how well you can hear it. She's breathing very hard and very fast. So then people show up to the scene. Listen to her voice. Yeah, so she's screaming, she's panicking, she's shaking, she's breathing very fast, very shallowly. She thinks she's dying. Yeah. So we have very shallow respirations, and her hands are probably shaking, number one, from panicking, but number two, because if you get that respiratory alkalosis, it's going to prevent muscles from working properly. So you can get increased responsiveness of calcium receptors in muscle. So you can get seizures from this. You can get arrhythmias. You can get tetany, where your muscles lock up. You can get carpal pedal spasms because your calcium receptors are being out of control. I don't know if any of you have had that. If you've had a panic attack and you get muscle cramps and your hands get locked into a certain position, or you get numbness or tingling in your hands and feet, that comes from respiratory alkalosis in panic attack. She is having a panic attack, which I'm not saying that that's not an important thing. We need to address that. She might need some medical intervention for this alkalosis that she has. But rushing in with Narcan is not going to fix her. And so that's why if you have somebody like this, and this is their reaction, giving them Narcan's not going to do anything. It's not going to do anything. And to address a point from earlier, is too much Narcan going to be a problem? There is a dose of Narcan that is problematic. However, it's a really high dose. So someone who has this kind of exposure to Narcan that doesn't really need it, is not going to have a lot of problems because it is an antagonist. It's going to block the receptors, but it's not going to cause the same effects as opioids. It's going to have pretty much a neutral response. So, Yeah, but Narcan doesn't hurt. But the problem is, when you're only, it's the logic behind going from, I see somebody struggling, they say they've been exposed to fentanyl, and then jumping to it must be a fentanyl overdose, get out the Narcan. And this is the logical disconnect that I try to debunk on this channel and on other shows that I'm on, because this is what I call cognitive laziness, where people, they make patterns in their head. They see patterns that are not there, and they have this assumption of, if A, therefore B, and they skip everything in the middle. So they had fentanyl exposure, police officers not feeling well, must be an overdose, get the Narcan. And this is a very poor way of thinking about this, especially when you're not an expert in medicine. You don't even know the other differentials. You don't even know the other options. You don't know the risks of what you're doing. So even us in our side chat just now, we're not even in a medical setting. And we already had, for that one video, we had at least 6 differential diagnoses that were presented. That's way more. If I had to sift through these differentials and say, is it fentanyl, or is it a panic attack? Is it hypoglycemia? Is it sleep deprivation? I'd need evidence that it's any one of those things. And the thing is, if you're going to jump to one of these, you should have evidence supporting it. If this was a fentanyl overdose, we would have evidence primarily of respiratory depression and pupillary constriction. You need objective findings in addition to these subjective findings. And you see that any good EMT or paramedic is going to roll up to the scene, and what are they going to do? The first thing that they're going to do is going to assess the patient. They're going to look at this person and see what objectively is going on here. And even they'll take the subjective into account, but they'll say, what is going on? What do I see happening? And if they notice pupillary constriction, or if they notice respiratory depression, that might indicate that they have an opioid overdose. And that's when they pull out the Narcan. But what we saw here in this video and in the other one, you see these police officers who don't know how to assess somebody. They're not looking for this pupillary constriction. They're not counting their respirations. They're not assessing this person at all. But they see distress and they grab the Narcan. This is poor reasoning. Poor reasoning. Are EMTs really trained to assess for mental health? Well, so paramedics are the ones in charge on the scene there. And here's the thing. EMTs and paramedics are not the end, they're not the end evaluator, right? So their job is triage. Their job is triage and immediate intervention. So they're going to go on scene, and let's say this person is in distress. And it's pretty easy to diagnose a panic attack, actually. But anything psychiatric, more than likely is still going to go to the hospital. Unless if it's something that's like a panic attack and someone knows that they're having a panic attack, they might not take them because it's low risk to leave them. But what would happen then? They assess the patient and they take them to the hospital, and then you have either an emergency physician or they consult psychiatry. Somebody else is involved in this person's care at the hospital. So, sure, I'm not saying that this person doesn't need to go to the hospital. They might. For certain panic attacks, you might need to go to the hospital. But using this to justify panic around fentanyl is a bad idea. It's a bad move. Yeah, mental health diagnoses required. Yeah, so they'd be going to the hospital and they'd be getting a psychiatry consult is what would happen. Let's watch another video here. So there's that one. This one was a big one that was going around.
Shocking body cam video released tonight.
Shocking
by the
body
San
cam
Diego
video.
Sheriff's Department. It shows a deputy on the brink of death after being exposed
And listen to this
fentanyl.
language on the brink of
saved
death.
by
They
his
are
partner who was equipped
there's so much
with
bias
the
here.
life-saving medicine known as Narcan. We do want to warn you, what you're about to see is difficult to watch.
Nearly dies after fentanyl exposure. Yes, you see all of this panic.
Dramatic body cam video capturing
They
the
take
moment
out the
Corporal Scott
Narcan.
Crane of the San Diego County Sheriff's Department is promising his trainee, Deputy David Five-Eye, he's not
Yeah, and
going
it's
to let him
it's
die
Fox
after
and it's
Five-Eye
Fox
was
News. So
exposed
there
to
you go.
fentanyl while processing drugs at the scene of an arrest in early July. That discovery caught on Five-Eye's own body cam just minutes earlier.
Yeah, it's a powder.
Could be cocaine or fentanyl.
It could be cocaine or
The
fentanyl.
synthetic opioid is 50 times more
Those are very
potent
different
than
drugs.
heroin, and exposure to just a few small grains can have deadly consequences. In Five-Eye's case, the exposure and his reaction to it was almost instant.
A couple seconds later, he took some steps back and he collapsed.
All right, so once again, here we go. We talked about this. How long does it take to be exposed to even get a therapeutic dose? A lot more than a minute or a couple seconds. So this, after a couple seconds, went down. There we go. I think we know that this is not fentanyl. Yeah, I'm so glad we have news reporters out there telling us that they're on the brink of death. 100% legit medical conclusions. Yeah, absolutely. Yeah, it takes hours to get that. So a couple seconds. This is not fentanyl. This is not the fentanyl. Can we use fentanyl fears to get cops to wear masks during pandemics? I mean, it's dishonest. I still wouldn't do it, but maybe, it might work. It might work.
I ran over to him.
Then he collapses.
I grabbed him and he was ODing.
Corporal Crane was equipped with.
So look at that. Look at that stellar medical assessment right there. Look at that stellar medical assessment. You had, he fell on the ground and I knew he OD'd. How? How did you know that he OD'd? How did you come to that diagnosis? Educate me. Educate me on how you diagnosed that as opposed to something else. Uncle Beck makes a great point. It could also be heat exhaustion. Exactly. If they're outside and this is in California, heat casualties are a very reasonable cause of syncope. So if it's not fentanyl, then was this staged? Or like it could be staged. I mean, I wouldn't take the conspiracy route right away, but it's possible. Or it could be a different substance, sure. But it's not fentanyl. This is hyperbole at best.
With the nasal spray Narcan, a prescription medicine that rapidly reverses the effects of an overdose.
And he immediately grabs the Narcan.
Five-Eye needed more. Here he is, in his own words, still emotional.
My lungs just locked up. I couldn't breathe.
My lungs locked up and I couldn't breathe.
Gasp for breath, but I couldn't breathe at all.
So that's not the mechanism. That is not the mechanism of how this works. We talked about this. Respiratory depression caused by suppression of the brainstem, and you're not able to take deep breaths, but nor do you need to. You do not feel like you need to breathe because your brain's telling you that you don't need to breathe anymore. So if you feel like you needed to breathe and you couldn't, that's not the mechanism of action of opioids. Fentanyl can be ruled out by the speed of the response. Is there any substance that could have that type of reaction quickly? My thought, for something like this, in that small amount, probably not, unless you had like some very concentrated like pesticide, like organophosphates, could cause similar reactions to this. Those are anticholinergics usually. So like if you were on a farm and you like were underneath a crop duster, you might get some of these symptoms. But something else, if you had a lot of dust or something, like let's say you were inhaling some dust and you got some irritant in your lungs, that could cause you to be gasping for breath and feel like you need to breathe but can't. If you're around somebody who's smoking a high amount and you haven't ever before, you might have an allergic reaction or You might not be familiar with that kind of substance, so you might have that kind of reaction. So there are plenty of other things. POTS would be something more chronic. He could have POTS. More likely, if he had POTS, he would have experienced that before. If someone hasn't OD'd, there probably would not be negative effects of Narcan unless you gave a lot of Narcan. Like, it's a very, very high dose that you'd need. But just hearing his response, this is not consistent. Not consistent with...
Are you okay? Talk to me. Oh, no. Don't be sorry.
And he's hyperventilating right there.
Don't be sorry. There's nothing to be sorry about. I got you, okay? I'm not going to let you die.
Deputy Five Eye taken by ambulance, overdosing again and again on his way to the hospital.
Overdose. Hold on. Whoa. Okay. I just noticed that they said that overdosing again and again. So they're claiming that he had repeat exposures on the ambulance ride to the hospital. This is hilarious. This is absolutely hilariously bad. And it's possible. I'm not going to say that his panic reaction wasn't real. He might be having a real panic attack. And if he believed that he was going to die from this exposure, he might have PTSD from this. Even though it wasn't a real drug overdose, if you believed you went through that and you believed you were going to die, you might have an acute stress disorder or PTSD from that. It's possible. It's also possible that this was faked. I can't say this for sure, but giving him the benefit of the doubt, this is not fentanyl, but this could be a result of poor mental health care in the police force. And of course, this is related to poor health education in the police force and it's very, very poor training. And this is why it's important that we have this study that we talked about, the 2017 study from the ACMT, because we need police education reform. We need this in our system to do better. And what we need to do is figure out a way to where the police forces will listen to these scientific bodies. And of course, an organization that the police trusts immensely, that hasn't been listening to the ACMT on this is the DEA. The DEA has been perpetuating these drug myths and further stigmatizing people and further preventing people from getting healthcare. So the DEA is very responsible for a lot of these myths. And if they got on board with the ACMT, if we could convince the DEA to change their education, I think we could resolve a lot of the issues going on with this police stuff. So, I mean, that's just my take on it. But I don't know if there's anything else interesting in this video.
Without his partner and that Narcan, he knows he would have been just another statistic. And this country,
without that Narcan, he would just be another statistic. He's like barely even putting that Narcan up his nostril anyway. Like, that was very poor application of it. Like, that just barely went in. So he's probably not even getting like a full Narcan dosage. But anyway, not important because it wasn't going to help him. But
I almost died of fentanyl overdose.
Over the last year, fentanyl deaths in California have spiked almost 46%.
So when they're talking about fentanyl deaths, again, this is an equivocation fallacy. So they're equating this usage of injecting or orally consuming or using sublingual concentrations of fentanyl, which that is a problem. If people get a tolerance, they might use more of these. But we're talking very, very high dosages in those formulations in routes that would be harmful And then they're comparing that real statistic to this accidental overdose that we know isn't true. 46% from what base number? That is a fantastic question, and I don't know. I wanted to look at some of these comments because I keep forgetting to read them. They're funny. There's nothing to worry about. I won't let you die. Yeah, it's so funny. Like it's so dramatic. And then people are saying, I'm so happy he survived. Amazing story. And people talking about their family members who overdosed. The look in his eyes as the other officers administers Narcan is terrifying. You can tell in that moment that he was dying. No, you cannot. You can tell he thought he was, but you cannot tell that he was dying. And I've been on scene with people who've OD'd from heroin, more than likely. I don't know for sure because I didn't do the GCMS on their samples, but like I've been on scene where we've used Narcan and we've saved people. But I mean, and even the goal of the dose of Narcan is not to wake them up. The goal is to help them breathe. So it's to reverse the respiratory depression. So you give them just barely enough to keep them breathing, and then you take them to the hospital. Because, yeah, as someone mentioned earlier, you do not want to undo their high, especially if it was an intentional high. Don't undo that, because they might get very combative. And it's just the way that they're showing this Narcan, they're making it seem like this miracle drug that all of a sudden you were unconscious and now you're not unconscious anymore because this Narcan was a miracle. That's not how this works. And they didn't have the complication of fentanyl that we're trying to undo is amazingly enough, the complication that they're not experiencing, because they're experiencing the opposite of hyperventilation and not hypoventilation. Yeah, these comments are ridiculous. I have one more video. I had a couple, but I don't think we need to watch the other one. We'll watch this one.
Deputy lying on the ground on the side of I-94.
So this is someone sharing her experience
from a plume of white powder.
And that deputy is talking about all this for the
first
time.
Waukesha County.
Courtney Garish, and this has become one of the biggest risks now for first responders. Courtney,
it has, and we're talking not from a gun, not from a knife, from some weird little powder.
A routine traffic stop turned into a lesson in fentanyl for this Waukesha County Sheriff's deputy and her partner.
It actually almost sideswipes another car.
It was the end of February, around 9 p.m., when Deputy Sarah Krelevitz pulled over a driver for weaving.
He was very jittery. He wouldn't look at me.
She and her partner, Deputy
He was
Sam
jittery.
Weinkoff, ended
Fentanyl
up
does
searching
not
the car.
cause
The driver
jitteriness.
reportedly told them
It's
marijuana was
probably
in
on
the
meth.
vehicle and a gun, which ended up being loaded. They also
It's probably
found
meth
drug
or cocaine.
paraphernalia.
That already makes us think potentially cocaine, heroin.
Fentanyl never crossed their minds, but this lockbox they found in the car,
because the mechanism
drastically
wasn't
changed
there.
the
He was
course of
not.
the traffic stop.
There's no objective evidence of fentanyl.
The deputies couldn't get it open, so
Weird little
Krelevitz
powder,
tried
yeah,
to figure
hyperbole
out
and
what was
exaggerated
in it.
dramatization.
What sound does it make when I tip it? This plume of white smoke just comes out of it.
And then Krelevitz says she started feeling a tickle in her throat. Less than a minute later, she was completely out of it.
What was
Less
wrong
than a
with me?
minute
Why
later.
can't I
Again.
function?
The last thing Krelevitz remembers were the lights on her squad.
Laying there watching them get slower and slower and slower and slower.
She wasn't able to talk to us anymore. She wasn't responding to what we were saying.
That's when a trooper at the scene grabbed his Narcan. Krelevitz came to in the ambulance. She later discovered she was exposed to fentanyl. That led to some quick changes in the department.
Yeah.
I always put gloves on.
All Waukesha County Sheriff's
You should put
deputies
gloves
now
on, that's
carry
fine. You should-
fentanyl-resistant gloves and masks. to better
Fentanyl
protect
resistant
them in a
gloves.
search.
The way that they phrase that as if you need some special protective equipment for fentanyl resistant gloves. No, I have those gloves here. These are nitrile exam gloves. Everybody in a medical office has these now. Reason being nitrile, not because it's special fentanyl resistant, because it's not latex and people are allergic to latex. So nitrile works pretty well and is not as allergy inducing as latex. So that's why we use it, but it's not, You can buy these at like any pharmacy. Like they sell these to everyone. They're not unique to fentanyl resistant gloves. That's just ridiculous. Yeah, you're protected. AA is protected from fentanyl. Everyone get your fentanyl resistant gloves because you're gonna need it. Every time you see a powder, you should be wearing your gloves. No, but actually, if you don't know what a substance is, gloves are probably a good idea. But there's actually, this is an off-topic story, but there was a time that a good chunk of my city was shut down because there was a spill of some unknown white powder from a truck. And it was really funny because they got hazmat involved. They're like, we don't know what this powder is, which is understandable. I mean, it could be some corrosive substance, like, or some industrial cleaning supplies, which you probably don't want to breathe in those. But it was really funny because it turns out they had analyzed the substance and it was pre-workout powder. So they had shut down a good chunk of the city for a spill of pre-workout powder from a truck. So that's my favorite thing that happened. So yeah, make sure you wear your caffeine resistant gloves to be protected from your pre-workout powder. But yeah, so this sounds like stuff that we can all laugh at. And it's very funny to see people exaggerate these very underwhelming issues. But it's causing a lot of problems. And we talked about this with the education of police officers. It's further stigmatizing people who use substances, and it can prevent people who overdose from getting care, because if these police officers are not willing to go into someone's house, or if EMTs and paramedics, God forbid, became as equally afraid of this, if they refuse to jump in when there's virtually no risk to them, you could see people not getting help. You also see, as mentioned in the comments, we had somebody mention that their family member refused fentanyl for cancer pain because of all these myths about it. And if you have somebody who needs fentanyl, some people need this. And it's very easy to blame opioids, and there are problems, and there have been problems with improper opioid prescription and improper use of opioids. But that doesn't mean that by default these compounds are going to kill you. It doesn't mean that we should stop using them entirely. Some people need them. And if we perpetuate this fear-mongering and these myths, then people who need this as medical care might not get it, or they might turn it down because they're terrified now. Because Fox News told them that they could die just by having a little bit, or being exposed, just touching a little bit. And that's a good point. Why isn't there an EMT falling prey to the fentanyl pandemic? Yeah, you're not seeing this among EMS or fire departments as much. You're not seeing this among social workers as much. You're not seeing this among emergency physicians or other people that are involved in the care of people who might have fentanyl on their clothes. Why is it only police? And this relates to their education. And I'm sure there are some that fall prey to this. I'm sure there are some EMTs, small amounts of EMTs, small amounts of social workers that buy into this. But it's few and far between for those fields as opposed to police. Now, fentanyl patch users are often very stable on it. They do very well with this. So if used appropriately, it's not as much of a concern as people want it to be. And we need accurate information, accurate education. And so I hope today's talk clarified some things about what fentanyl is and why this hysteria is unwarranted. Those are kind of my takeaways from today. I guess if I were to talk about what I learned today, I learned that you have to wear your fentanyl resistant gloves, and make sure that anytime you're in public, anytime someone is feeling sick, you give them Narcan because Narcan's a miracle drug and it'll solve every problem. Everything that's going on, you can use Narcan. No, don't do that. Do not use Narcan for everything. It's not necessary. If you suspect someone is having an opioid overdose, of course, if you're around people that use fentanyl, even for prescription reasons, oftentimes, if you're prescribed an opioid, oftentimes you'll also be prescribed Narcan, just in case someone overdoses. Let's say you have someone who's elderly and they have cancer, and they also might have some memory issues, and they forget if they took their pills that day. So they might take an extra dose unknowingly and might overdose, especially if they're more susceptible at that age. So some people might be prescribed Narcan along with their opioids. So if you know somebody who is taking opioids or is using, then it might be a good idea to learn how to use Narcan appropriately. What are signs and symptoms of opioid overdose? What do you need to watch out for? And then be ready to, if that happens, call 911, get them to appropriate care facilities, and then use your Narcan if you suspect that. But you don't need to Narcan everybody. And I hope that was helpful. And in terms of announcements on this channel, in the upcoming weeks, there's not as much going on right now because I just got back from interviews. We're kind of debriefing a little bit from interview season. But on Monday, I'm going to be going on as a special guest on Mama Deb's channel. We're going to be talking about mental health and healthcare workers. And there's some scary stats along with that. In fact, some recent events in the medical community have me really wanting to talk about this. So come hang out with us at Mama Deb's channel on Monday evening. I think it's 5 p.m. Pacific time or 6. I don't know. It's sometime in the evening Pacific time on Mama Deb's channel. And then Friday, we also have trivia. We have trivia every Friday at 9:30 p.m. Eastern time on Twitch. So come hang out with us for trivia. We also have medical myths next week. I'm not sure what my topic is going to be, but we'll find something fun to talk about. I actually might try to do TikTok trends next week. I might bring on a special guest to talk about TikTok trends, like sleepy chicken. I want to talk about that NyQuil chicken trend on TikTok. So those are some things you can look forward to this next week on my channel. And of course, right after this, we have the Patreon after show. And you don't have to be a Patreon necessarily, because if you are a channel member, you can also sign up for a channel membership, and that will also get you access to the after show, which will be, you can find the link for that on Patreon, or it will also be in the patron section of the Discord. If you would like to join us there, if you are a patron, we have some fun. Kay's Cooking has some new videos out, so we'll probably react to those. But thank you to our lovely patrons. We have Reggie, Jody L, Pharmacy Sabrina, Tons of Mice, Uncle Beck, Haney Ball, Kevin Downey, and Charlene. Thank you all for your support of the channel. I hope to see you all in the after show. It'll be a great time. And also, something, since Phoebe's here, I wanted to announce this, but we're still pegging down the time for sure. But I believe on October 15th at 8:30 p.m. UK time, we're going to be doing a trivia special for an all UK panel. So stay tuned to see who's going to be on that panel, because we got some fun guests. It's going to be a great time. But until then, I'll see those of you who are patrons in the Patreon after show. And stay curious, everybody. I will see you all